Thank you. Welcome to our virtual conference, the Spotlight on Industrial Wellbeing, highlighting the past, present, and the future. This session we'll be discussing school-based mental health funding. We have with us Amy Diet. She's the co-founder and owner of a women-owned, mission-driven consulting business called Advancing Dynamic Solutions that works at the intersection of education, public health, and behavioral health to create and advance solutions for youth and communities. Amy has dedicated her career to supporting the integration of health and wellness into educational systems and policies and has worked with state departments and school districts for over 15 years. She has written, managed, and implemented numerous federal and state school health funding streams, how how schools are funded, opportunities exist, be braided, strategically leveraged to sustain behavioral and mental health efforts in schools. Amy was director of school health at the Colorado Education Initiative for over 7 years, supporting over 178 school districts in integrating health policies and procedures. She also has worked at Tri-County Health Department and has been a second and sixth grade teacher. Amy represented the United States as a 2017 Global Education Policy Fellow in China and has held on the state and national coalitions and committees. BS in biology and by Colorado State University and her master's in teaching from University of North Carolina. And now I'll turn it over to Amy. Thank you so much.
Thanks, Tania, for that nice introduction. Welcome, everyone, to this session. We're going to be talking, like Tania said, about school-based mental health funding. We're going to learn more about identifying that funding for vital behavioral and mental health programs and services for our students. So thank you so much for having me today. Tania did a great background. I'm one half of a small mission-driven business called Advancing Dynamic Solutions, and we're happy to be with you today. So what we'd really like to cover within our kind of 50 minutes together is to describe current state and federal funding that can be utilized for school behavioral health, as well as identify some of those key levers or strategic opportunities to promote and sustain school behavioral health efforts. To get started, we're going to do a little welcome activity. So in your chat, you should see a link. You can also, if you'd like, do this on your phone. You can take a picture of that QR code just to let us know who's here today. So I invite you to click on that link, and when you open it up, it allows you a spot to type in your role or job title. So I'll give you a moment to do that. See some of our responses here. Mental health counselor, school counselor, director of school health, youth project manager, an occupational therapist for mental health. That's fantastic. Awesome. Well, thank you for doing that quick activity just to help me know who's in the room today. All right. So why are we here today? Essentially, why behavioral health? Luckily, especially with who we have in the room, speaking to the choir. So much research shows us that healthy students learn better. That's kind of a saying we might hear quite often, but to me, that doesn't quite value a student who may be living with a chronic disease. So what I like to say is when students' health needs are met, they are better able to learn and engage in school. So we know science this specifically comes from the Learning Policy Institute that children and youth learn when they are healthy, safe, and supported. And we know learning is impaired when their physical needs are not met, maybe fear or trauma is present, or they're just overcome with emotions. I mean, essentially it boils down to when students are in their feeling brains, they can't be in their learning brains. So why behavioral health in schools? Well, there is some research out there that shows that school-based mental health services can improve, of course, access to care. Slide's not moving, sorry about that. Allow for early identification and treatment of mental health issues. You then have better mental health outcomes, and you reduce access barriers specifically for some of our underserved population, including children from low-income households and children of color. But it goes beyond just the health outcomes. We also know that health and wellness just matters in schools. You'll never hear a principal or teacher or even a superintendent say they don't care about the health of their students. That's just not what they're held accountable for. That being said, research does help us make the case for why integrating school health efforts actually can have a profound impact on educational and accountability measures that do matter. We know that when you integrate health and wellness, you have an increase in learning readiness, school engagement, academic performance, and a decrease in absenteeism, behavioral issues, and truancy. All that being said, we know there are a ton of challenges that exist for schools in trying to integrate health and wellness. Some of the smaller, more rural school districts that we've worked in the past, they're literally deciding between, do I have the funding to hire a math teacher, or can I hire that school nurse or school counselor that I need? So how do we overcome some of this? According to some recent research of the landscape of school behavioral health services across the nation, the factors that limit the school abilities the most to effectively provide mental health services to students are making sure that we have, enough mental health professional staff coverage, so essentially manageable caseloads. You're looking at workforce shortages because we don't have adequate licensed mental health providers, and of course, inadequate funding, which is what we're here to talk about today. So the three things I'd like to cover with you is one, leveraging and identifying funding. So what exists, what opportunities do we have? Utilizing data, which is very important, and then identifying those interventions to cover with that funding. So the first thing we're going to dig into is really the heart of it, which is leveraging funding for behavioral or mental health. The first kind of tip and tricks that I'd like to talk about is identifying those health and wellness opportunities within more sustainable funding sources. Yep, I actually said sustainable funding. Maybe we should say sustainable-ish, as anything can change if the law changes or fiscal dollars are not approved at the government level. But title dollars have remained for decades, and so we are looking at federal dollars through the Every Student Succeeds Act, or ESSA. Understand the politics around these topics. Who else is vying for this funding? Where is it currently going? Where does that energy come from, and where does that direction stem from? What are the priorities of your school, district, or state leaders? And how would funding mental health in schools support or further the mission, the vision, the strategic plan at the state, district, or school level? The next tip is identifying the kind of people in charge of decisions to know, who do you need to talk to? Who do you need to garner buy-in from? And then dedicating a point person for school health. This really helps with having a more systemic change and ensuring there's a role and a dedicated staff person to support those health efforts at the state and at least at the district level. It takes so much time, as you probably know, to build and sustain partnerships, to write and manage grants. My goodness, the grant reporting requirements, supporting schools with implementation. So having that dedicated point person for school health can really help with that. I also just want to note quickly that prioritization is really best accomplished by a broad-based team, which can help produce collaborative actions. Actually, Tania did a session earlier today on parent and community engagement. And one of our keynotes, Amanda Lipp, talked about nothing about us without us, which I couldn't agree more with. I have done half to full day sessions on this topic. With more time, we've added a whole section on engaging key partners to support this process from start to finish, which includes youth, parents and guardians, community-based and other kind of key partner organizations to help you make these decisions. So let's dive in. So some of that quote unquote sustainable funding sources that you can leverage is federal funding that's based off of a formula or a specific population. So there are, as you might know, a number of title dollars outlined by the Every Student Succeeds Act, or ESSA, which is the 2015 reauthorization of the federal law, the Elementary and Secondary Education Act, or ESEA. That oversees education in the entire U.S. So funding flows from the federal level to the SEA or the state education agency level to the LEA or the local education agency level, which is essentially a school district. Title I, which is the first one you see there, is the largest bucket of money that we have. It goes to districts at a higher level based off of the higher percentage of low-income families. This money can now, because of ESSA, actually be utilized to support school health services, staff, and supports. You can hire school health professionals with Title I dollars. Title II is really covering professional development. How do we prepare, train, and recruit high-quality staff? Again, for the first time ever because of ESSA, this can now be health-related professional development, as well as specifically spent on professional development for school health professional staff. So like our counselors in the room today. That was not the case before ESSA. Now, getting on the PD calendar is a different story, but at least you have some funding available. Title III, which is the next one you see here, is for our English language learners, or ELL, and that can include developing their social emotional skills. So specific to that student population, you can utilize these dollars for behavioral health supports. And then Title IV. Title IV is kind of our magic title, if you will, in the world of school health. There are multiple parts to Title IV. Part B is 21st Century Community Learning Center grants. Part F is community schools, which is wraparound supports for students and families. But the part we're going to talk about the most is Title IV Part A. And we're going to go through that in detail in just a moment. The other two federal or specific population funding that I want to talk about quickly, first is Medicaid. Medicaid is different in every state. It's actually determined by your state plan. So if you don't know anything about your school Medicaid program, dig in a little bit more. It's a huge pot of money that can be so beneficial and vital for school behavioral health services. The way Medicaid works, in a very simplified term, services provided by a Medicaid-approved provider in schools can bill for Medicaid-approved services for Medicaid-enrolled students. Now, in Colorado, where I'm from, we are unique that the reimbursement we then get returns to our state must be used to support the health needs for all students. So we have to bill for students who are on Medicaid, but when we get that reimbursement back, it goes to school districts. They create a local services plan that is then approved by our state, and those reimbursement dollars can then be used for all students. And that's where we get a lot of our prevention work. More and more states are moving in this direction. So it is worth looking at your state plan and your school Medicaid services to find out more. The other big pot of funds that we have is IDEA, or the Individuals with Disabilities Education Act. So this can fund a bunch of your school health professionals. They are required by law to meet the needs and provide the services to students on an IEP, or an individual education plan. If they have time, and depending on other funding sources, they can do prevention services and supports for other students. However, we do know that their caseloads, as I'm sure our counselors in the room can attest to, are often way too high. It's hard to keep up with the number of students just on an IEP. But understanding this law helps to know one main reason why schools are really required almost to have that downstream behavioral health direct service. There's no equivalent funding stream for upstream prevention services and/or curriculum, etc. But if you can hire people through IDEA, you can focus some of these other funds on other programs and services. All right, so let's go back to Title IV Part A, because this one is huge. What's interesting about Title IV Part A is, like all titles, the funding flows from the federal level to the SEA, which is again the state education agency, to the LEA, which is a local education agency. You can find out how much money you have in your state. SEA allocations are publicly available, usually on your state Department of Education website. What's really interesting about Title IV Part A is all local education agencies will receive a minimum allocation of $10,000. If that LEA receives over $30,000, 20% must be used to support student safety and health. The reason that's exciting is for school health efforts, we hardly ever see the word must or required or shall. It's usually we recommend or maybe we should. So this must is really cool. And a lot of districts do get over that $30,000 mark. And this is not widely known and there's not a lot of accountability around it. For those safe and supportive school activities, this can include a number of things that are evidence-based, such as school-based mental health services, evidence-based drug and violence prevention activities, even nutrition education and physical education, improving school dropout and reentry programs, and even school health training for school personnel. So a number of things that we might want to cover under school behavioral health efforts. The next thing I want to point out with Title IV Part A is as of 2022, President Biden signed a bipartisan Safer Communities Act, which provided $1 billion additional dollars in funding to state education agencies to be distributed under this Title IV Part A. So you have your original allocation for Title IV Part A, and this is $1 billion extra. It covers 3 years, so through September 2026. And it did require state education agencies to do a competitive process to award what they're calling the Stronger Connections Grant to high need LEAs as determined by the state. So your state Department of Education determined a competitive grant application process and defined what high need meant for them, and then invited local education agencies to apply for these additional dollars for the next 3 years to cover school safety and mental health, as well as preventing violence. So moving on to other funding streams, there is grant funding. So the US Department of Ed has grant funds that state education agencies can apply for, such as Project Aware, which focus specifically on student mental health. There's also the School Climate Transformation Grant, among others. You can go to their website. They have a grants.gov, which is linked here, where you can find other grant opportunities as they come about. Those are competitive, and I've written many of them. We've gotten 3 Project Awares in Colorado now. We also supported Oregon and New York. They're hard, gosh, but they're vital and they really, really help. You can also look more at the state level for grants. So usually state public health departments, which should be a key partner for education, can often have funding for things like sources of strength, suicide prevention programming, tobacco and vaping prevention and cessation, substance misuse prevention, education, and cessation efforts, nursing services, and even health education. Much of public health department funding comes from the Centers for Disease Control and Prevention, or CDC, and they are often looking for school districts to partner with. Sometimes these are competitive grants, sometimes they're not, but it's definitely worth looking at your state public health department for what resources they may have. There's also this cool tool called Community Foundation Finder. So at the local level, having community foundations, they also provide grants. Many of these grants could be more like playground grants or something like that, but there's also grants to help fund maybe a work group or a committee to come together and look at data, maybe to create a school climate survey, maybe to do a universal behavioral health screener. And so looking at the community foundations that you have locally can also be beneficial. So with foundations at the state and local level, there's also nonprofits. So nonprofits often also have funding and/or programming to support school-related efforts, especially around youth engagement. That could be really beneficial to look at resources that may be in your community. And look for organizations that may have similar mission and vision as the work that you want to accomplish. And finally, local partnerships. You can look at multiple opportunities that, again, are at the local level. And local can mean state, it can also mean community, county, even within zip codes, for a partnership to look at comprehensive school health. So nonprofit hospitals, their community benefit, they have to do a community health needs assessment. And often what they're seeing are behavioral health and mental health rising to the top. They want to partner with school districts. They often have money. They may even have nurses. They also don't always know how to partner with school districts. And so starting that conversation can be hugely beneficial. Community-based mental health or healthcare providers are in the same boat. and then local public health departments as well. All right, we're gonna take a quick activity, and I'm going to see what other funding streams you may have used. So I'm going to put a link in the chat again to a little Mentimeter. So I invite you to click on that link and just list any other funding sources you are aware of or are using for school mental health. It can be things I've already listed, or it could be something that I did not list, and then we'll have some more resources to share with everyone. So I'll give you a moment to do that. And if you have multiple, you can type them in the same box. Bring up the results here so we can see what people are writing. Oh, yes, thank you. In the chat, Dr. Marion Spencer. Sometimes the mayor's office has funding or city council members. Absolutely. We've had great luck with that with some school districts to actually have a chunk of money set in the city council fiscal budget. Thank you so much for bringing that up. Yes, HRSA grants, absolutely. Project Aware, partnerships with universities. These are great additions. Thank you. If you have others, don't hesitate to type those in, and we can share those out after the session. All right, let's dive into data. So how do you prioritize? Ideally, you're utilizing data. So some tips and tricks. Many funding sources already require a needs assessment, a root cause analysis, a written plan as to what the need is and what solution will be implemented. Medicaid local services plans, Title IV Part A, school improvement plans, and of course, grants. These all require needs assessment data to show your needs, to show why you need this funding. Using local data, and the more local, the better, to identify not only your strengths, never forget that, but also your needs and gaps can be hugely beneficial. And to already have those systems and structures in place can make it much easier to apply for some of these grants that may have a quick turnaround. Using the data can also help you understand and address what are some of those key issues so you can make better decisions about what programs, policies, or practices do we need to put in place. Once you have that and you have some data where you can really show not only your successes, but your needs for your efforts, it can increase your credibility, can help you get voice in the accountability processes, and really garner buy-in from administration and/or funders. So having data can be hugely beneficial. And I think we often forget there are so many different data sources. It goes well beyond achievement data. We have student level data. So there are health surveys like the YRBS or the Youth Risk Behavior Survey, climate surveys, student perception surveys, even attendance data, discipline data. Of course, universal screeners, if you're lucky enough to be able to implement one of those, suicide risk assessments, and even looking at your IEPs and 504s. And that could be literally just quantitating them. How many do we have? Or looking at them at a more holistic way to say, what are some themes of services that we are providing? And what providers do we have to make sure those are covered adequately? You have staff level data. So again, great idea to have staff climate surveys, staff perception surveys. There are other self-assessments. Even an FTE count can be helpful for a nurse or counselor, so you can look at staff to student ratios. You also have then school level data. There's health policy and practice assessments. So CDC has the school health profiles you can take a look at. You can look at your graduation rates, your mobility rates, your free and reduced lunch rates, maybe even health office visits and immunization rates. All of this can really help make the case for where you may have pockets of higher need. And then state and county data. There usually some level of a child health survey at the state level, usually by your public health department, and that can show physical and mental and behavioral health statistics and population health measures, as well as chronic disease profiles, insurance coverage, economic status. All of these, again, can help make the case and also are really good comparison points for you to show the need. So if you can look at your student level data, your school level data, and compare that to the state, the county, that can really show where there are some disparities and inequities happening. So just some steps for utilizing the data process. Again, having systems in place where you have a structure, maybe even just a staff person to not only access the local and state data, but to then to analyze that data. Some considerations, again, looking for that comparison data where it's available. Maybe it's from your school to your district, your region to your state, but that really can be beneficial. When you're analyzing data for strengths and gaps, you also want to consider, can you dig deeper? Can you identify who may be more impacted by inequities? Can we disaggregate by different populations? Maybe it's race and ethnicity, maybe it's gender identity, and looking at some of those populations in a different way, as well as looking at gaps that can be prioritized based on impact and feasibility. So some key questions to ask yourself when you're looking through data could be any of these, but what behavioral health issues have the greatest prevalence among our students? What are you seeing the most? Which of these behavioral health issues are we best able to address? If a school cannot and should not honestly have to do it all, where can you bring in partners to help build that capacity and still meet those needs? How can we leverage existing interventions, policies, or funding opportunities? Which of these issues can be addressed through community partnerships? And then what barriers exist that may limit ability to implement some of these interventions? That'll really help you get more to that root cause and identifying where to go next. So from that, then prioritizing the concerns based off the data and ideally addressing it through a multi-tiered systems of support framework or MTSS. You can also focus on investments that support capacity building and infrastructure while meeting those evidence-based practices and services. If you've been in the education world long enough, there are so many programs that are like the hot thing right now, and then they go away. Then we get something else that's great, and then it goes away. What can we do that's sustainable? What can we build into maybe our comprehensive health education courses? Maybe we just simply add health education to the master calendar. Maybe we simply add like a graduation requirement around even just a comprehensive health unit within biology. Really trying to figure out where you can really make a systemic difference. So we're going to go into MTSS, but I'm going to do just another quick activity to see our level of familiarity with MTSS or the multi-tiered systems of support. So put another little Menti in the chat. I invite you to click on that to open it up. And we'll see how familiar you are with the MTSS framework. Your little results here. We have a few more coming in. All right. So it looks like for the most part, we're either very familiar or somewhat familiar. So I won't spend too long on what MTSS is, but essentially it's another triangle pyramid model where you're looking at the base where you have tier 1, universal supports for all. This can include increased awareness, promoting wellness. It's really what you'd want all students to have a base of: social emotional skills, using trauma-informed and culturally responsive approaches, comprehensive health education can all fit within that. Tier 2 is then targeted for some. So based off of your data, what students need a little bit more support? Often schools here are offering some type of evidence-based group interventions to identify students. Maybe it's progress monitoring integrated throughout the day. Maybe it's check and connect. And then from there, you go to tier 3 or more intensive services for few. So here is where schools are offering, again, ideally evidence-based interventions, but more one-on-one work, counseling, really looking at immediate and ongoing student needs for our kiddos who need the most help. I think overall, the MTSS framework really tries to include school-based programs, intervention or services that address these different kind of levels of supports, ideally for student learning, mental health, physical health, and emotional behavioral health needs. MTSS also emphasizes the use of evidence-based practices, but you're looking at screening, you're looking at instruction, assessment, and early intervention to support student needs. So this is where we try to have some prevention measures versus just reactive measures within education. That's a very high overview of MTSS. This has become a much wider, more widely popular framework. It really came from PBIS originally, but you're seeing it in more and more states as we go along. So when you're identifying interventions, where on earth do you use the different funding? How do you braid and blend and identifying which dollar goes to which program? It really is possible to do so. And there are some kind of key hints, if you will, to know when to look at which funding stream. For staffing and contracting, ideally, you really want to look at the most sustainable, which is probably state and local funding through per pupil revenue. We know that money often just goes to our teachers, which is fantastic. We obviously need them. But if there is any additional looking at hiring a counselor or a school nurse through those dollars is kind of your first step. Next is looking at Title I and Medicaid for licensed mental health providers. You can consider IDEA for guidance counselors and caseworkers. You can even look at Title IV Part A. We often see school districts utilizing Title IV Part A for more of our, I guess in the public health world, you'd call it more prevention staff, but you're looking at like your school wellness coordinators, a health and wellness director, someone to oversee nursing and or counselor and other school mental health providers staff at the district level. Also, though, it's really important to note that while having staff on site is ideal, it's not always realistic for many schools or school districts, so especially in our smaller communities. So you may want to then consider hiring a school health professional, maybe a consultant, or partnering with community-based mental health providers and paying time for these health professionals from those centers. So you can share time, you can have a MOU or a memorandum of understanding to bring in these community providers into your school district, provide services on the school campus. So, and then of course, grant funding, which is probably the least sustainable method, but at least you'd have staff for ideally a few years. Some grants don't quite last that long, but a lot of people utilize the ESSER funds, which was the emergency funds through COVID, to hire a bunch of staff, and that funding ends the end of this month. And so now there's a scramble for how do we sustain those positions. And so ideally, if you're in that boat, you're looking at some of these other funding streams to keep those positions going. We've seen at a national level and a state level data showing actually some great gains. We've seen decreases overall in secondary student substance misuse. We've seen decreases overall in secondary student suicidality, which is fantastic. However, we've got to keep these efforts going. And when you disaggregate that data and you look at our various gender identities and racial and ethnic backgrounds, there are huge, significant differences that are causing huge inequities. The other then intervention to look at is professional development. So again, considering ESSA Title II, those are PD dollars, they're there. Again, getting on the PD calendar might be the hardest part of that, but making the case and garnering the buy-in and showing your data and the research is one way to do so. Considering ESSA Title IV Part A, especially if you have the Stronger Connections grant, and then grant funding. Grant funding can be utilized really well here, but just considering that it's not a one-time event, but something that maybe includes some technical assistance or some ongoing sessions, and or maybe even dollars for you to create some in-house trainings that can be sustained over time. Now we want to look at some of our programs and services. So how Title I, the universal services, like I was saying, are probably some of the hardest to find funding for. But you can consider ESSA Title IV Part A. You can make the case for Title I, although that's really hard. Those dollars are usually pretty heavily allocated immediately. You have ESSA Title III, which will cover needs for ELL students. Medicaid and IEDA can cover some eligible services for eligible students. So when provided by a qualified professional, universal screenings can, depending on your state Medicaid plan, be covered under Medicaid dollars. And then, of course, grant funding. When we're looking at Tier 1 programs, we're talking about, for behavioral health at least, universal behavioral health screenings, evidence-based programming, like even sources of strength, signs of suicide, second step, curriculum that might be recommended through CASEL, so looking at social emotional learning curriculum or SEL, and also looking at comprehensive health education curriculum, both of which should include elements that would help with behavioral health. So that's kind of some Tier 1. Some Tier 2 programs that fit more in that upper level might be mentoring programs for students, so like Check and Connect. It might also be classroom supports. Maybe teachers can have additional support to differentiate instruction from behavioral management. So you're looking at like brief interventions to address like that mild to moderate mental health behavior. So there's something called brief intervention for school clinicians, is something that we've seen funded pretty successfully through Tier 2 programming through some of these dollars. And then you're looking at more of the direct services. So again, this is where we're set up in our systems to fund direct services are a little easier, unfortunately, than some of our prevention universal services. But when you're looking at Tier 2 and Tier 3 services, you can look at Medicaid, you can look at IDEA, especially if it's written within a behavioral health IEP, Title IV, Title I, grant funding. And when we talk about Tier 2 services, we're looking at behavioral interventions. Maybe it's a functional behavioral assessment. Maybe it's a behavioral intervention plan. Maybe it's small group counseling and therapy. For those Tier 3 services, you're looking at more intensive counseling and therapy at the individual level, maybe even the family level, as well as other individual interventions like a suicide risk or other trauma risk assessment, psychological and social work services, and even making sure you have a nice referral system built and ready to go. So those are some other interventions and the various funding in order from kind of sustainability down that you can utilize for these programming. So in closure, that was a lot of information, but if you leave with anything, just know school-based mental health services really can not only improve access because it reduces barriers for some of our underserved populations, but it allows for that early identification. So we know it has better mental health outcomes and academic outcomes, which I just can't stress enough, because once we promote the benefits in the educational setting, it's really how we garner that buy-in to move forward and get some of this funding. Again, utilize multiple and diverse funding streams and resources. Unfortunately, right now it's a puzzle, and you really have to piece it together to really have that system in place that supports all students. Trying to maximize those opportunities within federal and state funding. Often people just don't know that Title IV Part A is there. In some states, it's a real simple kind of check the box planning process where it didn't necessarily require a conversation, but Title IV Part A should actually, by law, you should have a team coming together to discuss that includes youth and community members. You should have a needs assessment to show why you're selecting some of those items. And so sometimes that process is what you need to make the case. And then again, really looking at what systemic changes can we make? What can we fund that's more capacity building and infrastructure to really look at Tier 1, Tier 2, and Tier 3. And then finally, I'm going to leave you with a resource that tries to summarize everything that I shared with you in a simple manner. So I'll put that in the chat, and then Tania, we can get this on the website, but it's, again, a short resource that really outlines the various funding sources that are available to you, and how they might be utilized for health and wellness.
Much, Amy. It seems like we have just maybe 2 or 3 minutes for questions. If you wanted to drop them in the chat, I can respond to them. Someone says, where do you recommend?
Yeah, state and county data. That's a great question. So ideally, state and county data can be found at your state public health department. They often have some really nice population health data. So by law, state public health departments have to do a community health needs assessment, as do your nonprofit hospitals. And so they have to collect some of this population data. So I would say your kind of children's hospitals, if you can, and or your public health department. And you can just literally search up their epidemiology office and ask them. They love, they love to talk about data. So that's a great question, Elizabeth. Thank you.
Were there any other questions? We have a few minutes. All right. In the meantime, in case you're thinking of what to ask, I'd like to thank you for joining us and attending our session. Would you please take a moment to complete our survey? I've dropped the link in the chat, and it's also on your VFAIR's agenda page at the end of the description of this session. Thank you so very much, Amy, for your contributions today. And if there are no more questions, we can close. Thank you all.
Awesome. Well, thank you everyone so much. If you ever have questions, don't hesitate to reach out, and good luck with sustaining your school mental health efforts.